Karen Foley. We're here at the library for Authors Night. Today I have the privilege of interviewing Dr. Jerry Kornfeld, who wrote Your 100-Year Heart, Simple Steps for Keeping Your Heart Alive and Well. Do you want to be called Dr. Kornfeld or Dr. Jerry?
Dr. Jerry is usually what people call me.
Okay, that's what we'll call you.
Thank you.
What was your incentive for starting to write a book with your busy practice?
Well, what happened was I was in a period of time when I was getting so frustrated seeing young men with heart attacks, young men who have cardiac arrest and die. And I am firmly convinced, and I have been for a long time, that heart disease is absolutely a preventable disease. It's our number one killer of men and women. But the fascinating thing about it is it doesn't have to be. It's preventable. And because of that, I said, I've got to put out a book that deals with lifestyle change, which is the key. We'll talk a lot about lifestyle change because it's a very hot topic now. I wanted to get out a book and tell people what they could do to change the statistic so it doesn't have to be the number one killer. And that was the motivation.
Now, it's interesting you say the number one killer of men and women, because at one time, the number one killer for women was breast cancer. And now, heart problems became the number one killer for women.
It has changed drastically. Interestingly enough, by the way, breast cancer used to be the number one cancer killer of women. That has now changed. It's now lung cancer. Just as men, women and men have the same number one killer because of, and I firmly believe this, women didn't really start smoking until after the Second World War. It was not socially acceptable for women to go out and smoke. After the Second World War, everything changed, and the smoking started then, and it's increased now to the point where lung cancer, cigarette smoking, women, men, and heart disease. So it's really the culture, our society has done this.
Do you think heart attacks and heart problems increased in women, or the fact that doctors are now taking women seriously and not patting, saying, oh, you don't worry your pretty little head about this, it's probably stress?
That's another great question, because you're hitting the nail right on the head. We in medicine, at least in my time and during my years that I taught at UCLA, we considered heart disease to be a male disease. Right. So if a man came to our office and he had chest pain, the first thing we thought about was heart disease. A woman comes into our office and has chest pain, we don't immediately think of heart disease because we're trained to think that this is a male disease. Well, over the years now, we have learned that obviously it's a serious disease in women. And in all my years of practice, I never saw a premenopausal woman with a heart attack. Women before her period stopped. I never saw a woman who had a heart attack before her period stopped. So I felt very strongly it was estrogen related. And so did most doctors, that estrogen levels was keeping the heart from attacking you. And so we have now gone through a period of lots of hormones. A lot of articles have been published saying that there are other factors involved. But there's no question, our lifestyle has created the problem for women as well as men.
You say lifestyle, and you've mentioned that before, and there was a lot mentioned in your book. What lifestyle has been killing us?
We are going through a very dramatic change in medicine. I get a little bit frustrated with this because for years, medicine, until this day, we rely upon evidence-based information to make our diagnosis and our treatment problems. And so mind-body medicine and lifestyle was really not considered to be the most significant thing. Well, that's changing now because we're now going through a very exciting time where we're getting evidence to support the relationships of what you do and how you live and how much health you have and how much you survive. So lifestyle and mind-body medicine is becoming much more acceptable in the medical profession. And so now we're looking at three things. And I have an acronym that I use. It's called DEA. Not the Drug Enforcement Agency, but the D stands for diet, the E stands for exercise, correct? And the A stands for attitude. Yeah. You got it. Absolutely. DEA is what I leave all of my talks, and I'll mention a little bit later about my series of talks called Living to 100 with Quality. But I know it's a series of 5 talks, and people don't get it all. But if I can get them to leave just memorizing the DEA, because that's the key. So lifestyle encompasses the food you put into your body, the amount of exercise you give to your body, and how much stress and your positive attitude that you treat your immune system with. Those are the bases. And I'm absolutely convinced, after all these years of practice, that's the secret of a long life. That's the secret of staying healthy.
But you mentioned diet. I've been reading a lot about diet because I have these strange diets and strange foods that I really love to eat. I go on an ice cream diet once or twice a year, and nothing happens to me. And now I'm reading that butter, steak, and coconut oil won't kill me. Years ago, it was to stay away from all red meats. But now it says, you need some of that fat. You need some of that protein. You need some butter. What do you do? Who do you listen to? And how do you make sure it's a balance?
It is very frustrating because a lot of the forces that are publishing the articles telling you to eat red meat, to eat more eggs, to eat all the foods that are high in saturated fat, and I'll describe saturated fat in a second, are being published to a great extent by the manufacturers of the products.
Oh, that's
They are
absolutely.
putting these on. This recent surge, we always talked about egg yolks being high in cholesterol. Recently, in the past couple of years, there have been many articles out saying that's not true. You can eat as many eggs as you want. Well, research was done and found out that 70% of those articles were written by the egg industry. So you have to be very, very careful. I offer to every one of my audiences evidence-based information. I never report anecdotal information. Anecdotal information, you talking to your neighbor and they just went on a diet and they took a pill, that happens every day. Anecdotal information has no evidence to support it, so I do not report. You don't want to come to me and ask me a question, and my answer is based upon a conversation I overheard this morning. You want me to tell you an answer that's based upon evidence that will support it. And so it's very difficult. It's difficult for doctors, but it's very difficult for patients to separate what is real and what is not real.
It's the same thing when you read an article or a promotion that says what to eat, because you're not told who conducted the study.
Absolutely correct. What you have to do is you have to rely upon the experts. Now, in the research I did for my book, obviously I relied upon the American Heart Association, American College of Cardiology, and New England Journal of Medicine, all these very, very strong evidence-based books. American College of Cardiology, American Heart Association strongly recommends the diet that I recommend, and that's called the Mediterranean diet.
Yes.
And you've probably heard about that.
Of course.
It is a diet that is a plant-based diet, does not encourage meats, especially red meats, and I've got articles from Harvard and all over telling you how dangerous the red meats are. The Mediterranean diet encourages plants, vegetables, fruits, fish, soft drinks. Interesting enough, a little wine, Chianti. We can get into wine also.
I read a study that says now the medical profession is saying that a drink or two of wine is not that good for you. So one day I hear it's good, the other day I hear it's not good.
It is very confusing. But I still encourage it. I say a glass of wine, 1 glass of wine per day for a woman, 2 glasses for a man because of metabolism. But the evidence is out there. And I'm going to go off on a tangent, though, but in the skin of the red grape, there's a very potent antioxidant. And that's another area that we should talk about. So there's evidence, and the evidence is indicating that the skin of the red grape is it's not the white grape that has this skin in it.
It's the red wine.
It's only the red grape that has this skin in it. So we do recommend. There was something called the French paradox. There was a study published, and I think it was on 60 Minutes, the television program several years ago, that the French, with their diet that is very high in fats, animal fats, cheeses and dairy products, have less heart disease than we in this country have. And they started looking at what were the possible reasons for that. Well, they finally came out with an analysis of the skin of the red grape to find this polyphenol, this antioxidant, which has a very strong protective effect. So that's what I use as my evidence to recommend the diet that I recommend. It's very difficult, and I realize that. That's why I do what I do. That's why I try to get out to as many audiences as I can to explain what the evidence is telling us and why should we recommend it. It's like with red meat. Harvard did a fantastic study in which they demonstrated something called sudden cardiac death. Statistically, the incidence of sudden cardiac death was like 70% higher in those who had red meat than did not. And you do the research, Harvard has got, I mean, just go on Google. Google red meats and Harvard, and you'll see all the stuff I'm talking about.
Just going a little bit outside the box on this plant-based, I understand that it's could be as healthy for animals to go to plant-based, not only because of they get diseases too, but it reduces carbon emissions and the footprint of all the destruction we're doing on this earth if they were to go from canned dog food, meat, to a plant-based, like kibble.
The veterinarian profession has made that observation several times, that plant-based diet is absolutely the healthiest diet. It is becoming a major fad, by the way. We have the vegetarian diet, and now the vegan diet, which has been around for many, many years, is now becoming extremely popular. And it is a much stricter diet than a vegetarian diet. But again, it's people looking for the DEA, they're looking for the proper foods to put in your body. There's no question now that you are what you eat. Food plays a very important role.
Now, the heart, what exactly are the symptoms of a heart attack? If someone is getting this feeling in their chest, what do they do? What can they do? I read one place, people who are older should carry around an aspirin in case they feel an attack coming on before the emergency team comes. If they have that aspirin there, they should pop that aspirin in their mouth, chew it up if they have to, and start the process going.
That is very valid advice. And if you call 911 and the fire department paramedics come to your house and you're having symptoms of chest pain, they will very often give you an aspirin. But it has to be a full adult aspirin.
Right.
325 milligrams. Aspirin, we use aspirin preventively, prophylactically, and therapeutically. The prophylactic use is one baby aspirin. That's 81 milligrams.
I heard that was only for someone who already had a heart attack. Can it be used prophylactically for someone who has not had a heart attack?
We want, if you had a heart attack especially, but we want any of the people who are subject to heart disease by family history, by symptoms without having a heart attack, and a lot of people who have no history at all are also taking it. Because what that baby aspirin is doing, there's something in your blood called platelets. Platelets form a clot. The clot is what gets into the artery and blocks the blood from flowing through. And that's what causes the heart attack. A lot more complicated, but I'm oversimplifying. The baby aspirin literally takes these platelets, which are the substance that makes the clot, and takes away the adhesiveness.
Like a thinner.
They don't stick together. And if they don't stick together, they can't form the clot. So that's to prevent the clot. Once you have the clot, then we treat it therapeutically by giving you one adult aspirin.
Okay.
So when the paramedics come or you get to the emergency room with chest pain, they will give you one adult aspirin. What that does, the clot is already formed, but that prevents the clot from getting larger, so less of the heart muscle is involved. A heart attack is fatal if a lot of the heart muscle is involved and the heart can't pump. Well, if you can catch it early with a large aspirin, you'll have minor damage, but you won't have significant damage. So aspirin, 81 milligrams prophylactically, 325 therapeutically.
With all that you're saying, I remember that I missed but heard a lot about your talk that you gave for the senior center here, for the Savvy Seniors.
Savvy Seniors, yes.
And when I look back at some of the emails we exchanged prior to setting up this date, it's an amazing biography and resume that you come with. You graduated UCLA undergraduate.
Correct.
Then you went to UC Irvine Medical School.
Correct.
And let me read it here. You also serve, you hold an MD for the UCLA School of Medicine. You serve on the clinical faculty of the Geffen UCLA School of Medicine. You're a top-rated speaker for Vintage International, a world organization of CEOs. And you also have the opportunity to go on cruise ships and give talks there, and a long history of television and radio appearances.
I have.
You must have a wonderful opportunity always offered to you to spread the word of something you love and do so well.
It is absolutely
unusual for people.
Yes, it's a highlight of my life, because you're absolutely, it gives me the opportunity. As a family physician, my dedication is to the entire family, and my dedication from public health, my undergraduate degree was the UCLA School of Public Health, is education. And I feel there's two things as a physician I can do. I can obviously diagnose and treat you by examining you, but I also can teach you how to be healthy. And that's become one of my goals. So I do both, and I love every moment of it.
Well, teach us now how we can tell and separate a heart attack from stress, anxiety, and just maybe climbing too many stairs at one time and beating heart.
It can be very difficult. So my general philosophy is err on the side of safety. So if you were to call me at 2 o'clock in the morning and say, Dr. Kornfeld, I'm having a chest pain, what should I do? There's no question my answer to you. I would say, I wouldn't even ask you anything. Once you said that to me, I'd say you go immediately to your local emergency room and let them, because now we have blood tests that can...
That's right, I read that somewhere.
That can
Thank you for
tell
bringing it
you
up.
if the heart muscle is damaged, it releases an enzyme, and we can check for that enzyme so we can tell. But I don't want to take a chance, because if you're not having a heart attack, call me a fool. Say you sent me to the hospital for nothing, but you know what? You're still alive. I don't take a chance. You have chest pain, go to the emergency room, unequivocally. Now, they'll make the diagnosis, and they'll take care of you. So the symptoms of the thing now that we will get into. Classic heart attack symptoms are described as a crushing feeling on your chest, as if somebody was sitting on your chest. And then that pain going from your chest often goes to your neck, to your left shoulder, and your left arm. Now, I've just given you the classic symptoms, and that happens in the majority of times. Crushing chest pain, associated with shortness of breath also, by the way, associated also with cold sweating. You start to perspire, cold sweating, crushing chest pain, shortness of breath, pain going to your left arm. A lot of stuff to remember, but any of those can be a symptom. Now, the problem you get into is that there are what we call atypical heart attack symptoms. And those are the typical. Those are the majority. The atypical, and they're a little different in the women than they are in men. Men and women, you've often heard, well, women's symptoms of a heart attack are totally different than men's. Well, that's not true. But they do have different atypical symptoms. So a woman could get crushing chest pain, a woman could get pain going to her shoulder and arm, and that could be. It doesn't have to be. There could be other things that cause that, but I don't take a chance. I don't take a chance. So the male chest pain, symptoms I've described, pretty typical. The female can have back pains, can have stomach pains, can have a feeling of gas, can have soreness in her jaw. All of them sort of subtle, all of them not as aggressive as the crushing chest pain. And those milder symptoms are what, as I described to you before, we as doctors would sort of ignore. And we would say, well, it's gas, it's the food you ate, it's something to do with a female system, etc. But fortunately, those days have changed, because now we look for the heart attack in women with symptoms as well as for men. So crushing chest pain, going to your left side of your body, your left arm, your shoulder, shortness of breath, cold sweat are classic symptoms.
I understand diabetes can be a catalyst for a heart attack.
Unfortunately, diabetes, we have two types, type 1 and type 2. Type 1 more than type 2. Type 1 is sort of genetically, you have to take insulin shots. Type 2 is we can control with diet or oral medication. But they both act on the arteries by inflaming the arteries. An inflamed artery becomes a good candidate for clot deposits, and these clots are cholesterol deposits, and that forms something called plaque. Plaque clogs the artery. The analogy I give is if you have a hose and you've had it for many years and you turn it on and the water comes trickling out. Well, what most of us do, we take the hose, we cut it in half, look inside, and it's filled with crud. That crud's because 30, 40 years going through that hose, this junk is deposited. That's the same analogy with your arteries. If the artery gets filled, we call it plaque, made up of cholesterol and other things, that artery now gets obstructed. That obstruction doesn't let the blood flow through. If the blood doesn't flow through and you're doing any exercise, you need more oxygen. Oxygen comes from the blood. Can't get through, you do exercise, you get chest pain. And we call that angina. Angina is a prerequisite for a diagnosis of many people with coronary artery disease. So you want to make sure you're doing everything you can to keep your coronary arteries as clear as possible with hardly any plaque in them at all. And that's the way that we examine you and look for that plaque. I do a thing called Dr. Smartphone Will See You Now. We don't even go to a doctor's office. The smartphone does a diagnosis. The smartphone now has an EKG associated with it. So you wear this EKG, it's not plastic, it's a couple of straps on your chest, and it monitors your heart 24 hours. And it goes into your smartphone. And your doctor can pick that up from there. And of course it sends an alert. The smartphone then is the monitor. But the best way for you to be concerned about this is we have you wear a 24-hour monitor in which we can monitor your heart for or 48-hour monitor. We can monitor your heart for 24, 48 hours. And we look for things like arrhythmias, irregular heartbeat, things like that.
Well, what exactly is a stroke, and is that related to a heart attack in any way?
The only relationship that a stroke has is they both involve an artery that's clogged. The stroke usually is associated, a stroke can be a hemorrhage or a clot. A hemorrhage means that a vessel in the brain starts to bleed, and that causes blood to go all over the brain, and that causes the paralysis and the trouble breathing and even death. The clot forms in the arteries, just like it does in the coronary arteries. It forms in the cerebral arteries, or in the artery in the neck called the carotid artery. And that pieces break off, go to the brain, clog the main arteries in the brain, and you can't get oxygen again, and tissue dies, and the area where the tissue dies produces the symptoms: paralysis, shortness of breath, difficulty breathing, severe headache, numbness, tingling, numbness on the side of your face. Those are all vascular. But people who are candidates for stroke often are candidates for heart attack because they've got the vascular component of their carotid arteries or the arteries in the brain.
Well, your intention is to keep us all living, or the heart living, till we're 100. Do people really want to live to 100 when their body parts, the DNA for all your body parts, hasn't kept up with the longevity that we're now experiencing? It's going to take years before they start our body will start producing our organs and our systems that they can take 100 years. Right now, we're replacing knees, hips, we're doing shoulder surgeries, back surgeries, all to prop us up. Our memory goes, and yet our heart would beat on.
You know, this is a great sequel into another subject that I want to talk about, because I do a series of, especially here in Calabasas. I've done for the past 3 or 4 years to the Savvy Senior Group in Calabasas, a talk called Living to 100 with Quality. And the two key words are with quality. Living to 100 by itself, obviously, nobody wants to live to 100. Sitting in a nursing home, in a wheelchair, not knowing who they are. My 2 words, with quality, say, the goal of my talk is to have you live to 100 and still play tennis. That's the goal. And
Even
so,
if you've never played tennis before.
well, it's just like, can I play the piano now? Yeah, well, I never played before. Well, play now. Yeah, the whole concept, whatever you want to play, but at age 100, I show slides during my talk of individuals, 80, 90, and 100 years of age. I have one of a 101-year-old gentleman who just won a bicycle marathon in Paris. I have a 90-year-old lady who works on the parallel bars in the gymnasium. I have a 90-some-odd-year gentleman who lifts weights. One of the things I include is debunking the myths of aging. We have a lot of myths that our culture has passed on. We've been brainwashed because people, we've doubled our lifespan in the past 100 years. We've doubled our lifespan. So I said, what is the future? What's the next 100 years going to bring? We are now doing things in science and research that are absolutely mind-boggling because we're looking to see why cells die. Group of researchers at Cambridge University in England have come up with a project saying, do cells have to die? And they start off their talk, one of the talks they do, with the following question. The first person to live to 1,000, not a question, a statement, excuse me. The first person to live to 1,000 was just born. Now, how do you react when you hear that? Everyone, what? Nobody can live to 1,000. Well, the point is, they said, why not? Why do cells have to die? We've taken for granted that, the saying that two things have to happen, taxes and death. Well, why do cells have to die? There are some animals that don't die. Some animals can regenerate all of their organs and their tissues. Well, genetically, we are 99.1% the same DNA as every living thing. Animals, plants, trees, that's 0.1%, whatever that statistic is, that separates us. So what makes the animal live without dying, able to regenerate? That's what they're looking at. And they're saying, how do we know we have to die? How do we know the cell has to? Why can't we keep the cell alive? And they're looking at something called telomeres. I know I'm giving a lot of information, but this is fascinating. Telomeres. You can look this up. You can Google T-E-L-O-M-E-R-S. Telomeres. They are noticing now that telomeres are attached to the DNA. They are on the tip of a chromosome. We have 23 pairs of chromosomes. Chromosomes control all of our body features, etc. The telomere is attached to the tip. I describe it on your tennis shoes. You have a little white cap on top of the shoelace. The telomere is the white cap on top of the chromosomes. Well, they are discovering that aging is associated with shrinking of the telomere. The telomeres get smaller as you age, and that's what finally kills you. So the researchers, well, what can we do to keep the telomeres from shrinking? If we can keep our telomeres long, does the cell have to die? And the University of San Francisco came out and published a study. I've talked about, remember, about evidence-based? They have just used those same words that I use. Lifestyle. Lifestyle can keep the telomere from shrinking. Proper lifestyle. They did a study on nurses. The Nurses' Health Study went out for 28 years where they followed nurses. They literally can measure the size of telomeres. Doctors' offices cannot do that yet, but the research facility can do it. And they measured the size of the telomeres. And they found that those who had the healthy lifestyle, their telomeres did not shrink. So there's all this evidence. I could go on for hours. That's why my series is 5 lectures, giving you all of the evidence, supporting the fact that we're on the verge of major breakthroughs in longevity.
I'd like to go into discussions between doctor-patient relationships and the importance of that, and how do you see medicine in the future?
Another area that I am very, very involved in, because we are right now in the process of losing one of the most important aspects of the practice of medicine. As I said, for many years I taught a class at UCLA Medical School called doctoring. Doctoring class taught freshman medical students the art of patient-doctor relationships, because it is truly an art. Patient-doctor relationships are vital to the patient doing better. Every study that's ever been done, those who have a good relationship with their doctor, as we discussed previously, if you like your doctor, you're going to do better. So patient-doctor relationships now are being replaced by the iPhone. Person is at home, they have a symptom, they pick up their iPhone, they call a computer or somebody, a non-physician advisor, and give their symptoms. It goes into a differential diagnosis, a list of all the things those symptoms could be. And then from the differential diagnosis, tests are ordered. And once the tests come back, all on the computer, it tells you what's wrong and what your prescription should be. And you've never once had a conversation with a physician. You never once had a physician tell you not to worry about this or whatever it is. You never once had the opportunity to look at your physician's body language. You know, they had a smile on their face or they looked a little bit nervous. We are very sensitive in medicine. And I wrote an article called Do No Harm recently, in which I wrote, we are in medicine by oath obligated to do no harm. But most physicians think of the do no harm aspect of our oath when it comes to not doing a surgery that was unindicated, prescribing something that's going to hurt somebody. But physically, I said also words that a physician uses could do horrible, horrible harm, especially if somebody has a terminal illness and the physician doesn't treat it with the respect that he should with the proper words. So do no harm. So patient-doctor relationships are extremely important, but they're going to be done away with. We're right now in the process of seeing this happen, and it's going to be the smartphone. The talk I do is Dr. Smartphone will see you now. It's changing the way medicine absolutely is practicing. And it's something that goes back as far as Hippocrates. Hippocrates is one of the first people, and I quote him, and it says, listen to your patient and you'll make the diagnosis. I taught my medical students that 80% of the diagnosis they make will come from taking a good history. And we graded them by bringing in people in the theater arts program at UCLA, giving them a script that they memorized, that had a certain illness, and we videotaped the medical student, first year, asking the questions of the history. And we graded them by the amount of questions they asked, whether the question's pertinent, whether the question's important, and how they did overall with that. And that sort of gives that feeling of relationships. You feel so much better if you like your doctor. You'll follow his or her advice, you'll take the medication they prescribe, and you'll feel more comfortable.
As we had discussed on the phone, I would feel a lot more comfortable if I could do away with my Medic Alert bracelet, my wallet inserts, and just have a microchip that if I faint or I don't feel well, or if I go to an urgent care or to an emergency room, that someone can just click me into a receptacle, not a receptacle, into a machine somewhere, and they say, this is Karen Foley, these are her allergies, these are her problems, these are the medications she takes.
Those are available. There's a problem of privacy that's getting involved in that. But what's really available is all medical records online. So you can go online if you are involved with an insurance provider that does this. You can go online anytime and find all of your medical records. And if you are in an emergency situation in another state, they can, with your permission, go online and find all your medical records. That's phenomenal. That's available right now. So your history is available online, and that's great. And the chip is an idea that's been around because that also would make it much easier.
My dogs used to have chips.
Yeah, but again, there's a privacy issue there that I'm not
Who's
sure.
Who's going to go around reading your chip?
I don't know. I don't know exactly, but I just heard. But I think it's a great idea. I absolutely agree with you. I think it's a great idea. We have to be able to know your history. And that absolutely would take away so much of the ordering of tests. By doing this, Dr. iPhone see you right now, you have a headache. One of the differential diagnoses is get an MRI of the head for a brain tumor. Well, 80% of headaches are not due to brain tumors. So all of these MRIs are going to be ordered, and they're going to cost more than the physical examination would have cost. So economics is the motivation for it, but it's going to backfire.
Every time people get sick, every time I complain about something, people say, oh, it's stress, it's stress, it's stress. Well, maybe it is stress, but how do I cope with the stress? How do I cope with staying healthy if I'm anxious about something?
You're doing a great job, Carol. You're leading me. These are areas that I love to talk about. Thank you. First, let me tell you, I define stress differently. I define the illnesses that are produced by the stress hormones. Cortisol and adrenaline are the two stress hormones. They are produced in the body, and we refer to them as stress hormones. I don't think that the stress itself is your enemy. Now, that's contradictory to everything you've ever been taught. I don't think the stress is your enemy. It's how you cope with the stress.
So it's not the
That's your enemy.
causation.
Huh?
It's not the cause of an illness. It's your body being able to handle it.
How you cope with it, exactly.
Okay.
And we all cope differently. We, based upon our entire lifespan, our programming as little children, our environment, the family structure, etc. We've learned to cope. So, the example I love to give is two businessmen, because I do a lot of these talks for Vistas, which is a business organization, go to a meeting. They both own equal shares of a company. Information is presented at that meeting that drives one of these partners crazy. Oh my gosh, I'm going to lose my business. I'm going into bankruptcy. The other heard the identical information, and he or she has already figured out a solution. So we all cope differently. So it's not the stress that I'm concerned about, but how you cope with the stress. And that is what I deal with, because it's very important. Now, I have a list of 10 steps for coping. And anybody who wants it, at the end of this interview, you'll get my email address. Email me, and I'll send you my list of 10 steps for coping.
That's very generous. Thank you.
But the number one step, and to me it's the greatest tool for everybody to learn, is meditation. If I were to come to you and say, Karen, I have a tool, it won't cost you 1 penny, it'll make you feel better, there are no side effects, there's only benefit, why wouldn't you do it? There's no negative. That's meditation. It is the simplest, least expensive tool for relieving anxiety and stressors. That is the greatest coping tool there is. And you can learn meditation. You can go online. You can Google meditation. There are CDs available. It's something you have to work at, though. It just doesn't come from one experience. But that's absolutely number one tool. And the other very important tool is exercise. I'm going back to my DEA about longevity. Well, here's where exercise comes into play, because it is a great coping tool. It's a great anxiety reliever. And exercise does not mean that you have to go join a gym. You can, obviously, or you have to run a marathon. You can, but just walking. 30 minutes a day, 5 days a week, walking. It's absolutely statistically valid for increasing longevity and for decreasing heart disease. So there are two big pluses. Absolutely meditation and exercise.
You mentioned that. I remember people used to ask me, why do I love skiing so much? Is it this, is it that, the challenge? No, it's the fact that you have to put all outside thoughts aside, all anxiety, all fears, all problems, and concentrate on getting down where your feet are, and just one step at a time, one jump at a time, one mogul at a time. And the time you're down the hill, you feel good again. And you go back up, and at the end of the day, you haven't thought about your everyday cares and your worries and your problems.
Do you meditate?
No.
Because you have just...
I eat chocolate.
Okay. You have just described, though, one of the major problems that people have with meditation is they start to calm down, but as I'm talking to you right now, hundreds of thoughts are running through your mind. It happens to all of us. It's very hard to concentrate on one thing. But when your brain is working so hard, it's very hard to be calm. So the monks over in areas of the world where they have lived the Thai monks especially, they've lived the calmness of meditation from generations. They can, at a moment's notice, concentrate on one thing. So they can make their breath slower, breathe less rapidly. They can lower their heart rate. They can control their body temperature. They can relieve their anxiety just with a thought. And to demonstrate that, a professor from Harvard Medical School, who has written many books on this subject, took a group of physiologists over to the area where these Tibetan monks live, high up in the mountains, snow on the ground all the time. They walk around with orange shirts or cloths on top of them. He had them take off that orange sheet, lie down in the snow, hook them up, they brought a group of physiologists with them, hook them up to the machines, then cover them with a sheet that had been immersed in ice water. Ooh. They're lying in snow, covered with a sheet of immersed water. In 30 minutes, that sheet gave off steam. And their body temperature rose. Because meditation, concentrating on one thing, gave them the ability to control their body's physiology. Now, wouldn't you love to do that? Would all audience members love to be able to control your body temperature? Well, you have the gift. You have the tool called meditation. Learn how to do it, and you will absolutely cope with your stress. It is a great gift, and that's also part of lifestyle.
I love to end on such a positive, achievable goal.
Absolutely achieved by everybody.
I want to thank you so much, not only for a wonderful book, which we will have in our library as soon as the program is aired, and you're very generous in giving your email out where people can get in touch with you.
Yes, I enjoy doing that. By the way, the book is available on Amazon.
Amazon as well. They can purchase it or check it out. That's great to know. This is a book, quite frankly, that I read from page to page.
Excellent.
And it's an important book to have in your home.
Excellent,
so
yes.
I'm glad that you did
Yes.
that. So I want to thank you so much.
Well, thank you for
having me.
having
Wonderful guest. Thank Media Operations Department, the library, and leave you with these words. Growing older is a given. It's inevitable. Aging is your choice. Thank you all very much.